In 2017, researchers conducted a cross-sectional study assessing associations between social emotional development in young children and their number of daily routines involving an electronic screen. Researchers define social emotional development as how a child manages and expresses emotions, develops close and satisfying relationships, and actively learns from the environment. Past studies have demonstrated that parents feel electronic devices are a safe way to occupy young children so other tasks can be completed. This study focuses on whether electronic devices are in use during times when both a parent and a young child are meant to be engaged in a routine together, and how this affects the social emotional development of the child. Researchers asked for pediatrics practices from Ohio and New York to provide families with study packages at routine medical exams. Within these packages was an ages and stages questionnaire on social emotional development, a media diary, and a background form, and participants were selected based on the completion of these forms and whether or not they met the eligibility criteria, which required that the children be between 12 and 36 months of age, have a primary female caregiver, have never been in foster care, and have no suspected or confirmed language, cognitive, or motor delay. In the final analysis, 103 girls and 107 boys were eligible to be part of the study. And to determine whether or not the child was considered at risk for social emotional delay, statistical analysis using SAS was done on the Ages and Stages questionnaire. The ASQ is a well-known parent-completed pediatric office screening tool. There are separate questionnaires for different age intervals, each with a separate cutoff score. For example, at 24 months, caregivers have to answer questions like, does your child look at you when you talk to him? Does your child greet or say hello to familiar adults? When upset, is your child able to calm down within 15 minutes? Parents have the option of responding always, sometimes, rarely, or never, and parent responses are totaled to obtain a single score. A child who meets or is above the cutoff score is considered at risk for social emotional delay, while a child who is below the cutoff score is considered socially emotionally competent. The results determined that 8 out of the 103 girls and 13 out of the 107 boys were at risk for social emotional delays. In order to determine screen exposure, the caregivers were required to complete a media diary for one typical day at home. 10 common routines that the researchers considered naturally occurring activities ideal to building social emotional skills were listed, and besides each routine was a column to indicate what type of device was used, whether it was used for the entire duration, who was using it, whether it was in the background or the foreground, and the name of the application or program being used. The results showed that 204 of the 210 children performed at least one routine in the presence of a screen, and that 114 of the 210 had at least 5. The screen was most often on during playtime, breakfast, and bedtime, and it is interesting to note that more than 2/3 of the sample had at least one meal with an electronic screen switched on, and more than 1/3 of the sample ate all 3 meals with an active electronic screen. When considering social emotional development, children at risk for social emotional delay were more commonly exposed to the screen during all routines as compared to children not at risk at all. However, when considering the accuracy of the results, it is important to consider the limitations of the study. First off, the sample size was small, selected based on convenience, and only had participants from 4 communities. The caregivers were all of female gender, and the answers were based completely on caregiver response, and thus honesty. Some possible mediators and moderators include the education level of the caregiver, could be the cause of the child being at risk for social emotional delay rather than screen exposure, the specific length of time the routine takes, whether or not a child was using the device alone or was the caregiver engaged with the child while exposed to the screen, and the types of media the child was exposed to could all influence the way the results are interpreted. Based on the results of this study, the research discouraged screen use in children under 2 years of age, which, while I recognize that technology can be useful in occupying a child when absolutely necessary, I believe that the American Academy of Pediatrics is accurate in stating that unstructured playtime is more valuable for the developing brain than any electronic media exposure. If a parent is not able to actively play with a child, that child should have solo playtime with an adult nearby to allow them to think creatively, problem solve, and accomplish tasks.